I'm Claudine Wong, joining you from KTVU in the San Francisco Bay Area, and I'm joined now by Dr. Yasko Fukuda, who is the chair of the Academy of Pediatrics of California. Thanks so much for joining us.
Good morning. Thank you very much for having me on.
So let's talk about vaccinations, and we're not talking about the coronavirus vaccine that is in the works, because we're all still hoping for that, but we're talking about all those other vaccines that we already have, and that it's so important for our children to get. I mean, normally in a schedule from the time a child is born until they're 18, there's a lot of vaccinations, right, that they get on a very specific timeline.
Right, that's right. There are actually 16 different vaccines that we give over a child's life, and the most of them between 0 and 2 years old. For all those that have your little children, remember bringing your babies in and they get poked all the time. And and certainly during this whole pandemic with shelter in place, emphasis has been really let's vaccinate those young children. And I think for the most part, actually, that is happening. But one of the concerns that is starting to come up is everyone is listening to shelter in place and not going out and trying to distance from others to, control this pandemic. And so children are not coming into the doctors that should be coming for their well care and then not getting a lot of their immunizations.
So there's this new report that just came out. I'll pull up this graph and we can explain what we're looking at. But this actually takes a look to see, there's the way that doctors feel like they know they have fewer appointments or they're not seeing, their patients as much. But this really tracks down to see really what is actually happening. And it's pretty dramatic.
It really is. So last week on the 8th, this report came out. The report is called MMWR, which is a weekly report that comes out from the CDC, the Center for Disease Control, intermittently every week to just comment on a health issue. And what they tracked between the beginning of January till April, which is what this graph shows, is the VFC program is the Vaccine for Children's program that covers about half of the children in the United States who are on Medicaid, federal program. This tracks the vaccine purchasing so that you know how many vaccines are getting bought and in the doctor's office ready to go.
So as you're using them, you have to reorder them, and that's
right.
What they look
Exactly.
at. Okay.
So the order is going to reflect what you're using. And they also have data on the administration of vaccines throughout. So it's not only what you order, but what you give to children.
And that's the bottom half of the graph.
And that's the bottom half of the graph, correct. So the what is very striking in all of this is that you can see on March 13th was the emergency across the US after the pandemic was declared. And from March 16th, the orders plummeted, as you can see. The bottom graph is showing how many vaccines are given, and those also drop. If you notice the dark lines, bars, those are children under age 2. So although there was a drop off, people are slowly trying to come back in to give those younger children their vaccines. What's very concerning are the children who are over age 2. Those are the gray bars, and you can see how those have really dropped off, less than 10%.
That's dramatic, and I think maybe it's because, 0 to 2, they're used to those frequent doctor's appointments. Once they get, I think, right into school age or a little bit older, they come in less frequently, and maybe they're missing their annual checkups that they had scheduled for this period in time.
Right. So the points of sort of entry, and it goes along with the regular vaccine schedule, is between age 4 and 6. You get all your shots that you get ready for kindergarten, right? And then there is, in California, a 7th grade entry requirement for your tetanus with your whooping cough. And then there's a meningitis vaccine that's for the older kids that are in high school and off to college. So what we're worried about is that many of those children are not getting those booster shots, as we call them, and that there is going to be a lot of unvaccinated children. And we already know if you reach a critical point when people are not vaccinated, then you have diseases emerge. And we've seen that with measles not too long ago. And we've also seen that with whooping cough. And so what we worry about is that on top of coronavirus, we're going to have other things.
So do you think this is simply a matter of people thinking they maybe can't go to the doctor, or are they scared to, just leave their houses to go to their appointments? Or it could be a combination of maybe both, or maybe the fact that they're not in school, so they're not thinking about these things as well.
Right. I think it is a combination of all those things. I think people are being careful about what they're not supposed to do, which is great because that's working. But I think there is a fear to really enter any kind of healthcare facility, hospital. We know the emergency rooms are not seeing as many patients. And people think, well, I'd rather not go to the doctor's office because I might be exposed to something. And it's understandable, it's the fear of what's possible. But I do think the message that pediatricians understand that. I think across the nation, there has been many conversations about how do we keep kids safe and still give them their vaccines they need. Most offices has been very creative about only well children in the morning, or if they have multiple offices, only well child at one office and any sick children that we see. We're doing a lot of telehealth, which is from phone calls to video calls, etc., just to help alleviate patients' fears. And we
Right. I
don't,
mean, you can't,
but
you could do some things on telehealth. You can't obviously give a vaccination on telehealth, but it should remind people that there are fewer people in the office, fewer people in the waiting room if all these other issues are being dealt with
right,
telehealth.
exactly. So, and I think there's many conversations about how to best try to keep people safe. So it's actually pretty quiet now because people are not coming. So,
Yes, I mean, are you getting more? Are you seeing or hearing from other pediatricians as well that it's more cancellations, it's lack of scheduling? I mean, where are people kind of falling into that? Because if it's a cancellation because they're calling and saying, hey, I don't want to come in, I'm a little worried, then there can be a conversation to kind of tell them what you're doing to alleviate fears. But if they're not scheduling it, does it require you guys to kind of go through the records and say, no, these people are due, we need to make sure we check in with them and call them to make sure that these numbers don't get worse?
right. So I am a general pediatrician in San Francisco. I've been there over 25 years. I think everybody has their own approach. I think some people are canceling. Many are just saying, I'm kind of scared, I'm not going to go. We are now in May, and school will start at some point, and they will decide in terms of rules and what they'll bend to help people in terms of their requirements, understanding what's going on. We can, with our computer programs, right? Let's look up everybody who's 4 to 6 and start to reach out to them and try to get them in. So I think a lot of people are trying to do that kind of a recall. I think
it is, I think, a difficult thing too, when, in the Bay Area, we've had some extensions, obviously, on the shelter in place. It's hard to know how long those will continue to be extended, but Los Angeles County, for example, is going through July. And so you look at that graph and see what it's done through this point. I can only imagine if people's fears continue, what it will look like come July.
right. And even more, because then we have to start thinking about flu shots, right? And we do know that one of the big concerns in the fall, because we think coronavirus may settle down but then come back. When is that resurgence? I don't know. Co-infection is actually a big concern also, because the data in Wuhan actually showed children who got sick, oftentimes almost half, had two things: flu and the coronavirus, or pneumonia and the coronavirus. And those are the ones that were sick. So we worry about that, right? So
are you also worried about, I mean, I know, around flu season, when people are trying to get the vaccine, there's, sometimes when we've had that delay in the vaccine and it wasn't there and available at a certain time, then it certainly got very busy. Lots of offices had to do different clinics. There were lines at, pharmacies and things like that. And depending on, when society tries to get back to normal too, trying to get in to get your regular vaccine plus your flu vaccine might actually be pretty difficult.
right. So hopefully that's another sort of issue we'll have to tackle in terms of scheduling.
Yeah.
But I think the other separate issue that you brought in, if the kids don't come in, We don't know how their nutrition is. We don't know how they're growing. Certainly, there's a lot more inactivity, right? Because the kids
Hmm.
can't go out and do their soccer game or their basketball games. And there are some kids that are just sitting inside, and all they're doing is, of course, their online schooling, but it's giving them this opportunity to be on all of their devices, right? Much more. And so I think maintaining a schedule, having your meals together as family, watching that you don't overeat and have all your snacks all the time, right? Because it's easy to pick something up when you're at home. And thinking of some kind of activity that you can get as a family, just to exercise and get out and take care of that. And we don't catch that if they don't come in, right? There's also been a lot of developmental issues that are really important to follow with the kids. And lastly, I think really mental health for children is really important. This has been hard for everybody as society, worrying about the coronavirus, not being able to do our regular things. Of course, there's the stress in society that's going on, and the kids are all picking up on that.
Well, and I think it's important, right? Those are the discussions that you have, not only to check vision, hearing, get shots, and all those things. That conversation that you have with parents and with kids, that's not happening if they don't come into the office. Those are things that I think shouldn't be overlooked as well.
Right, exactly. So certainly the immunization and the data that's showing that we're falling behind, and the worry about vaccine preventable diseases, especially measles, whooping cough, meningitis, pneumonia, influenza when the time comes, right? But
Hmm.
I think all those important things that the kids have grown up in your medical home, hopefully, and hopefully you can maintain that contact with your pediatric medical home.
Yeah,
I
I
think
mean,
it's
I
important.
think it's the health is important. We are so laser focused on one issue right now. It feels like
Mhm.
that's the scariest, but it measles is also quite scary. Meningitis is
Right,
scary, and whooping cough, and all those things that when we've seen those outbreaks, those certainly give us great cause for concern. And I think, as you said, right, once there is an outbreak, then you have to really worry about containing it, which is a whole nother battle.
right, exactly.
And I think we are fighting enough battles right now. It would be nice to avoid a few more. All right, Dr. Yasko Fukuda, Chair of the Academy of Pediatrics in California. It's such a good message. Thanks so much. We certainly hope that those kids get back into their pediatricians and get those very important vaccinations that they need.
Absolutely, and we miss seeing the kids too. We'd like
Yes,
to see 'em.
I
Come
bet.
on in.
Come on in. All right. And for more interviews, you can, of course, log on to coronavirusnow.com. Thanks so much for joining us.